He was dying like, we were really sorry to hear this.
If you want to, I'll try to.
I don't know if she's going to call in today or not.
Good afternoon and welcome. The board will participate in 4 meetings today. The board has just returned from hearing expulsion speakers in closed session. In just a moment, we'll open the special meeting for expulsions where voting will occur. Following that, the board will move to our workshops where we will welcome Dr. Alina Alonso, the Palm Beach County Director for the Florida Department of Health, for a discussion on our infectious disease plan, followed by 2 other workshops, then a special meeting, and finally a special meeting for the Inspector General search. We'll now call the special meeting for expulsions to order. Mrs. Bass, please take the roll.
District 1, Barbara McQuinn. Here. District 2, Chuck Shaw. Here. District 3, Karen Brill. District 4, Erica Whitfield. Absent. Here. Oh, she's here. She's here. District 5, Frank Barbieri.
Here.
District 6, Marcia Andrews.
Here.
District 7, Deborah Robinson.
Here.
All right, we need a motion to approve Mrs. Whitfield's participation in meetings today via telephone. Motion by Mr. Shaw, seconded by Mrs. Andrews. All in favor? All opposed? Motion carries 6-0.
Thank you.
You're welcome. Also in attendance at the dais is Superintendent Dr. Fenoy, General Counsel Julie Enrico, and our Board Clerk Carol Bass. Will everyone please rise for the pledge to be led by the Superintendent?
I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Superintendent, do you have any items to withdraw from the agenda?
Yes, sir. I have to withdraw EXP4, expulsion of student 1920X035.
The board wishes to pull any items from the consent agenda? Seeing none, we need a motion to approve the agenda. Motion by Dr. Robinson, seconded by Mr. Shaw. All in favor? All opposed? Motion carries. That was a motion to approve with the agenda with the withdrawal. We need a motion to approve the consent agenda. Motion by Mrs. Andrews, second by Ms. Brill. All in favor? All opposed? Motion carries 7-0. We have no new business. We need a motion to adjourn that meeting. Motion by Mr. Shaw, second by Dr. Robinson. All in favor? All opposed? Motion carries 7-0. Yeah, we'll get started in the workshop as soon as everyone can get to that part of on their computers. The record should reflect that all 7 board members are still in attendance. Mr. Superintendent?
Yes, I'd like to read my comments at this time. As you may know, Governor Ron DeSantis declared a public health emergency in Florida and a statewide response protocol for coronavirus. While there are no known cases of coronavirus in Palm Beach County, we know that may change, and I want to assure you that the district is being proactive. We have initiated enhanced cleaning methods in all schools. The district's Department of Environmental Services and the Department of Food Services have implemented enhanced campus and kitchen cleaning for the next 30 days. This proactive district-wide cleaning initiative will be reevaluated at the end of March to determine if continued intensive cleaning is warranted. The school district is actively communicating with the Florida Department of Health and others and the Centers for Disease Control. Dr. Alina Alonso, Director of the Florida Department of Health in Palm Beach County, has graciously accepted our invitation to join us this afternoon and give the board and our community a broader understanding of coronavirus. As a district, we take direction from the Health Department and the CDC in matters such as infectious disease protocol. My priority is to keep our students and staff safe and well informed. This week, the district launched a website dedicated to coronavirus with updates and resources. On this site, you will learn everything from educational information to advice on how to speak to your children about the virus, to the status of district field trips, and more. The web address is palmbeachschools.org/coronavirus. We've also been communicating with parents and staff through email and social media communications. Please know that your feedback is valued and appreciated, and we will continue to keep you updated on a daily basis. At this time, I would like to present our first workshop for today. That includes Wanda Paul, Dr. Alina Alonso, and Mr. Paul Strauss.
Mr. Superintendent, if I could just make a comment on the record. I'd like to remind all who will be speaking today that this meeting is being transcribed in real time so it can be viewed with closed captioning. Please speak at a reasonable pace so the transcribers can fully capture what you are saying. Let the record reflect also that Inspector General Lung Chu has joined us. Mr. Superintendent.
Good afternoon, Board Chair Barbieri, Vice Chair Chuck Shaw, as well as our other board members and Superintendent Dr. Donald Fenoy. I'd like to again introduce Dr. Alonso from the Department of Health of Palm Beach County, as well as Paul Strauss, who is our Director for our Environmental and Conservation Department. Dr. Alonso will be discussing and providing an update on the coronavirus, and Paul Strauss will be providing an update on the district's infectious disease plan. And so with that, if you can start.
Thank you very much. My pleasure being here. It was great seeing all the board members. Nice to be here. I'm going to quickly go over some of the overview, including the outbreak, transmission and symptoms, treatment and testing, prevention, travel advisories, public health monitoring, and a community preparedness, which is what I think most people want to hear the most about. So our outbreak our update started March 1st when the Florida Department of Health reported Florida's first 2 cases of what we call now COVID, because you know everything in government has to have an acronym, so we decided instead of coronavirus we would call it COVID-19. Those 2 cases occurred in Hillsborough and Manatee County. The governor then issued the executive order directing public health emergency and establishing Florida's response protocol for the COVID-19. The state surgeon general then issued a declaration of public health emergency for the state of Florida. The outbreak occurred and began as a respiratory illness when it was first detected in Wuhan City, which is a province, Hubei, in China. The first case was linked to seafood and the live animal market. When these things combine, the virus then spreads to a person. And that's how all new human viruses occur. They go from animals, from birds, from swine. You've heard about the swine flu, the bird flu, and that's how these viruses all occur. And they usually occur in the Orient, and then they start spreading through the world like this virus is spreading now. It eventually ends up having person-to-person spread, and that's exactly what started happening in China. From China, and because of world travel and how globally we travel these days, it started spreading quickly to other countries, including the United States. Right now, we know that it has been spreading, and right now, worldwide, there are 90,870 cases worldwide in 73 different countries. 81 cases are in the U.S. in 12 different states. And there's 2 cases in Florida. The first one was the one in Hillsborough, which was confirmed from a trip that had been made to Italy. And then the other one in Manatee County, right below Hillsborough, has to now not had any connection with any travel outside of the country. In Palm Beach County, at this point, when I made this presentation, put this presentation together, we had 0 confirmed cases in Palm Beach County. Now, these numbers should not be kept for very long because they change every day. The report that we get, as you see on this slide, says as of yesterday. In the morning, we get the report from the day before. So that's how quickly these numbers can change. This is a map. If you go on the CDC site, it will show you that right now we almost have worldwide spread of the disease. So it's not quite a pandemic yet. We have the first 2 definitions for a pandemic, which means that the virus is serious, and there's deaths involved, and it's spreading person to person. But it has to be worldwide before it's considered a pandemic. So once it becomes worldwide, then we will call it a pandemic. These are the states. The geography teachers can take a look. We have Oregon, Washington, California, Arizona, Florida, Georgia, Wisconsin, Illinois, New York, New Hampshire, Massachusetts, and Rhode Island. Right now, those are the 12 states where we have confirmed cases of COVID-19. Now, transmission. How does this spread from person to person? It's spread through the respiratory droplets when a person coughs or sneezes. And it's spread among close contact. We're talking about 6 feet distance. So I probably will not get it from Miss Brill, but I might get it from Paul. So no sneezing while I'm here, okay?
I promise.
Thank you. Now, can there be exceptions to that? Yes, of course, because when people, one of the things people do when they sneeze, they do what? They cover their mouths with their hands. That's not a good idea, because what do? That's how you spread germs. That's how kids spread germs. They touch, they're eating everything, they're touching everything. So that's where the hand washing, and I will talk more about that, comes really into hand. So everything that we touch once I sneeze into my hands will be contaminated. For how long? There's different opinions on that, but until it dries. Now, I don't know about you, but I'm not going to go timing things to see how long it dries. So we just give the general advice to wash your hands often and clean surfaces. Oops, wrong click. Now, what are the symptoms? The symptoms, unfortunately, are very general. There's fever. And when we say fever, we usually talk over 101 degrees. There's coughing, and there's difficulty breathing. Now, please don't start trying to throw people out of work or telling them to stay home if they just have a cough or a sneeze, because we're in the middle of flu season. Okay, so I want to remind you, probably out of a room of 50 or 60 people, at least 10 of you probably have a cold. So when we're talking about cough, it's a serious cough, and difficulty breathing is because what these people are developing is pneumonia. Technically, we talk about lower respiratory problems. That's when your lungs are really affected and you can't breathe. Anybody who has asthma will have difficulty breathing if they have an asthma attack. That doesn't mean they have the coronavirus. So we've got to be careful. So anybody who has these symptoms needs to be evaluated and seen by a physician and by the health department. So how do we treat at this time? Anybody who thinks that they may have been exposed to the coronavirus should call the health department and isolate immediately. What do I mean by that? You can call the health department so you can talk to somebody, and they will actually talk to an epidemiologist who will go through a whole list of questions. Take a very complete history and symptoms. And then we advise that person whether they need to go to their doctor. But immediately, if a person thinks they have this, they should not go running off into the mall or into a public area, because then they could then come into contact with other people. So we want them to self-isolate, stay at home, and then we will call and make the connections with the doctor, or if they're in more distress, direct them to the hospital. We want people to call ahead. We don't want you just to walk into a walk-in clinic or even your doctor's office without calling ahead, because if you do have the virus, we need to make sure you have a mask on before you come in so that you don't contaminate the other people around you. So in terms of testing, the CDC does have a test available. The Department of Health and our Bureau of Public Laboratories are testing with the CDC test kits. We have the test kits in Florida. I repeat, we have the test kits in Florida. There's been a lot of talk about that. We've never had a problem here in Florida. The Food and Drug Administration, who approved these tests, requires that a presumptive positive test then be sent to the CDC for confirmation. So the person gets tested actually twice. There's still no commercial testing in commercial labs. So for persons who meet the CDC or the DOH criteria for the virus testing, your healthcare provider can work with our local health department, and we get the test done, and then it gets shipped to our Miami, for Palm Beach County, it gets shipped to the Miami lab. We have another lab in Tampa and another one in Jacksonville, and we have plenty of test kits. There's no shortage of those. Now, international travel or contact with the COVID-19 case may put you at risk. So you need to go to the CDC webpage. As you can see, the links both on your webpage as well as ours all talk about the CDC. That's the one that has the most accurate, up-to-date information. I know a lot of you get your information from the media, from other places, but please be careful because there's a lot of sites that are giving misinformation. So I recommend that everybody go to the CDC for the latest information. People who have close contact with someone who has had the virus could also be put at risk. And these risks could change over time. There will be more person-to-person contact, okay? So if you think you're at risk, the most important thing to do is to call ahead. You can call your health provider. You can tell them about the travel you've had, the places that you've gone to, whatever symptoms you have. And you have to, if you can, try to explain who you've come in contact with, because that's going to be very important in terms of being able to track this back so that we in the health department can then contact all those people so we can get them tested also. You want to avoid contact with other people, obviously. You don't want to travel while you're sick. Covering your mouth and your nose when you cough or sneeze, we're recommending that people use tissues, disposable tissues, and then throw those tissues away, and that people wash their hands with soap and water for the 20 seconds. You've heard the kids do the ABCs, if you remember that, or you can count your timer for 20 seconds. That would be very useful. So try to do that as much as possible. During H1N1, that was the one thing. You remember, everybody remembers H1N1 during 2009? We went through this already, right? That was a pandemic. The whole world had this very, very similar virus, same transmission, same problems that we had. And the most important thing that we kept telling people was to wash their hands. So how are we going to prevent it? Well, there's the hand washing again, soap and water. If you don't have soap and water, sanitizers that have 60% alcohol. Avoid touching your eyes, nose, mouth, and avoid close contact with people that are sick. So if you see them sniffling and coughing, you might want to walk away those 6 feet, stay away from them a little bit. And most important, if you're really sick and you have a fever and you're coughing, you're not feeling well like that, then you need to stay home so you don't make everybody else sick. Be careful not to overdo it, right? Because there are lots of people that have asthma, that have chronic coughs, that have allergies. Those aren't the people that should be staying home, right? So we have to use common sense when we talk about these things. There are travel updates and travel advisories. The World Health Organization is the one that puts these up. Again, these are all in the CDC guidelines, and it's just general information, so I'm going to skip this one a little bit. These are the countries that have been put as countries that have sustained community-wide spread transmission. That means that in these countries, it's not just one isolated person that is ill, like in Florida, that we have that one case in Hillsborough and then one case in Manatee. In China, Iran, South Korea, Italy, and Japan, there's sustained spread through the community from one person to the other. Okay? So that is why they have different recommendations for these countries to either avoid them or not travel to them at all, or only travel to them if it's utmost important. So you can go to the CDC website for travelers, and it will explain exactly all the countries, and it updates it on a daily basis. This is just an example of the CDC's health advisory that's been used. It's in Spanish, English, and Mandarin. They have 2 or 3 different Chinese languages that they're utilizing. They've implemented these for enhanced screening to detect travelers that are coming in with fever, cough, or difficulty breathing as they come into the United States. The screening procedure includes the traveler having to fill out a short questionnaire about where they've traveled, any symptoms that they may have, and any contact information. We get a list of people from the CDC every day that tells us who we need to go check on. And so our epidemiology department goes out, makes contact with these individuals, and we ask them questions. We give them a thermometer so they can, if they need to stay in their home for 14 days, during those 14 days, we're in constant contact with them, taking their temperatures, asking them questions, asking how they are, and having if any symptoms develop. So far, none of our individuals have developed any symptoms. That's very good. And they've been very cooperative, by the way. We're very thankful to them. Okay, so some monitoring. Personnel in we have 67 counties. Every county has a health department. And then we have the central office in Tallahassee. We all work together to protect the people of Florida from these emergent diseases. And we've done this, again, in 2009. We did it with H1N1. We had Ebola. We've had chikungunya that we couldn't pronounce for several months. We've had dengue, and then we had Zika that was very dangerous because it affected the women and the pregnancy. And so we've gone through these exercises before. So I want people, most of all, to stay calm. Fear is our worst problem. People get scared, and then they do things that they wouldn't normally do. So I'm very proud of the way the school board has been monitoring and been working very closely with all of us so that we can all stay on the same page and we can all promote the same messaging. I already told you that we're monitoring them for 14 days, staying at home. We're also, if we need to, we have a suspected case, then we take, they will be isolated. They may have to be isolated in the hospital. Again, we participate with the hospitals daily and with fire rescue. Last night we had a call with all the EMS from Broward and Palm Beach County. We have an incident command set up at the Emergency Operations Center where we're all working together with the county and with all the different entities, all our different support agencies. So we're trying to do this all together as one community. We remain at a low risk even though we have cases here. And again, that's why it's so important that people remain calm. More cases will come into the United States. There will be more people getting sick. That is to be expected. But right now, it's currently limited to person-to-person spread in the community. All these things can change, and we have to always, in medical field, we always plan for the worst, and we do what? We hope for the best. We do it with hurricanes. If we can have a Category 5 staring at us for 24 hours, we can definitely handle the coronavirus. But everyone has to do their part to prevent this spread. It's going to depend on the whole community doing the hand washing, protecting themselves from one another, and heeding the advices that are done and being promoted. And again, stay in touch with the CDC. It's very easy to reach it, cdc.gov/coronavirus. You don't have to remember COVID, all those letters. Just cdc.gov coronavirus, and it'll take you right to the corona information. You can also go to our website, which we have all the links to the CDC. That's floridahealth.gov coronavirus. You can also put in there. And then this is the CDC website. So if you just go to this part, cdc.gov coronavirus, that'll get you to the page. Now, this slide that I'm doing here, this is the response for the community. These are all the things that we have to talk about. The health department's down here, and it mentions how we have to talk to all our community partners, our businesses, travel, laboratories, healthcare professionals, the healthcare system. All these healthcare professionals in the system has been getting emails from us and faxes since January. We've been working on this for quite a while now. Now here you are in the schools, right? So what we do as a health department is we provide guidance for schools, including school closures or online education that may need to be done. But guidance doesn't mean that we make your rules, right? We work on all this together. So I want anybody listening to this knowing that these are not decisions that are just going to be made at random by different people at different times. These are going to be all worked out together and in a very methodical way, thought out and done. You have guidance documents that we have sent from the Department of Education at the state level. The CDC has guidance for the school, and this district has done an excellent job. The extra cleaning that you're doing is very proactive. The webpage that you have has all the proper links, so everybody should feel very confident being able to go on there and get very good, correct information. Uh-oh, I'm watching her sneeze. You did good. You did good. See what she did? She's an expert. So, you know, there's lots of questions. I know everybody wants to know how we're going to treat a sick student. You've heard instances where schools have had to close. But instead of getting into all those questions, what we need to know is that we're going to make these decisions jointly and with very good guidance from everyone that's involved in it. Students or teachers may become ill. We need to think about what's your volume, how many teachers can you have out at one time and still be able to carry on with classes. When is there any possibility of doing distance learning? I know we talked about one time. This isn't just thought about during times of pandemics, and I know that's all in your pandemic plans that you have dusted off and remembered that we had there, but this could also happen during a hurricane that completely destroys our infrastructure. So these are all things that people have thought about very often, and especially schools have thought about before also. Finally, I know already, I've heard you talking, that you've looked at your contingency operation plan, and you've already taken a look at that, so you're way far ahead of many other operations here in town. And again, I'm going to repeat that the motto in medicine is you plan for the worst, hope for the best. So hopefully this will be a good exercise, and we're going to get through this calmly and very logically, step by step.
Very good.
Do you want to entertain
Yeah,
questions? Or do you
I'd like
want-
to ask a couple questions before we move on, maybe the other board members also. So first of all, we have spring break coming up. If we have students traveling with their families to some of the affected countries where there's some restrictions on travel and they come back to us, should we allow them to come back into the classrooms when they get back, or should they stay self-isolated for 14 days when they return?
There's several answers to that. First, hopefully, we've given enough advice that people will not be traveling to the affected countries. Actually, those airline tickets actually are refundable. I think they have a period of time that they've run it through April, I believe, and those tickets are refundable right now. If a person does go to those countries, on their way back, they're going to be asked to be in isolation. We will get the list of those people, including their family members, and what they have to do. The health department will be working with you automatically if those are school children, so you will also know as a result of us knowing. And so I expect that to be a very smooth process. Not all the countries, not every single travel is included in that list, okay?
Right.
So it depends where they go and on their way back, the instructions that they get.
All right, and my second question is, we have, in March, I believe March, we have the schools being used for voting polling stations. So we're going to have people coming now the students won't be there, but I've read some articles, and of course you're the expert, that the coronavirus can last up to many days on flat surfaces. So how do we make sure that our schools are not infected by lots of people that come into the schools that may be infected, so that when the kids do come back the next day, they're safe?
Well, I certainly hope that every single person that's hearing this will go to vote. I'd be very happy to come to your school to vote, because you guys are doing a great job in cleaning the surfaces of the voting machines. There's a whole section in the CDC about voting polls and how to clean them and what should be done on them. There's a specific section just for that. So I guarantee you that the county voting person that does all that has many people working on that and planning that already, of how they're going to keep all the polling machines clean and making. Now, people themselves can take action. I have in my pocket my little 60% alcohol wipe that I can use before I touch anything. And certainly if I touch your computer, which I have, and your mouse, I will go outside and use my little alcohol and wipe my hands when I leave. As long as I don't stick that in my face or in my eyes or in my mouth, which sometimes I do, I don't have to worry about touching something with coronavirus.
Okay.
Now, will I purposely touch something with coronavirus? No, I won't do that trick for you, but you can. So there's two protections is what I'm trying to say. There's two layers of protection. One is the one that the organization will use. The second one, what the polling people will use. And the third one is your own individual protection. If you don't trust anybody, like Dr. Robinson and I that don't trust anybody, we will do it ourselves too. So there's multiple layers to stay safe.
All right, and the filters in our schools, will they, if there's an airborne coronavirus and it comes into the school, do the filters have to be changed? I'm concerned about voting day. We have thousands and thousands of people coming into our schools, and if there's anybody that's infected, we want to make sure the children are absolutely safe when they come back the next day.
This is a better answer for Paul, how you routinely change your filters, but this is a air droplet. It's
Okay.
not like tuberculosis.
Okay.
Okay? So this, we're talking about the distance that a air droplet will float in the air.
Got it. Okay.
So your filters are way up there. They're not going to go up there.
Okay, thank you. Ms. McQuinn, then Mrs. Andrews. Ms. Brill.
Hoping I don't get in trouble with the superintendent here. Several parents asked me when I was at a meeting this morning when we will make the decision about the Washington, D.C. patrol trips.
So we are seeking wise counsel from our friends. It is on our radar. We're looking at it every single day. Matter of fact, the deputy superintendent and I talked about an upcoming field trip. So let me say this publicly while I have this opportunity. I reserve the right to cancel any field trip up until the day of the trip. We are going to be starting parent meetings. Our general counsel has given us some documentation to provide for families, but we are literally checking it every single day. But we are going to probably institute face-to-face meetings with those families prior to them, especially on the out-of-country trips. We have several that are listed. And so the safety patrol trip, as of today, we've been given guidance that in-country travel is still okay. However, I think our parents, we just need to spend some face time with them to talk about all the parameters.
Mrs. Andrews?
Thank you, and I'd like to thank Dr. Alonso and Paul and Wanda for doing what you do. Last night we were at Wellington, and there was a presentation made to the village. And so one question would be, are we going to be connecting with the different cities where our schools are located with some of these presentations? And the second question would be, through communications, just what we're doing today, can we put this on our website so that parents can click in and hear everything that we're talking about at this moment? And we know that this is a fluid process, so it's going to be a whole lot of updates as we move forward. But parents are eager to get this information, and Chris Garrison did a wonderful presentation last night, and the chief of police about how we're working with the cities. So I just wanted to know the connection the school district will be doing with the cities where our schools are located at those council meetings as well as those educational advisory meetings.
So we have not discussed going out on a roadshow as of yet. However, all of the information that the communications team has developed is being shared with all the municipalities. It's on our website, so we can look further. If we're invited somewhere, we will absolutely be there.
Ms. Brill?
Thank you. So Mr. Barbieri already asked my questions, but what I wanted to share with you is that I look at this as I look at everything in life, teachable moments. And so what we are teaching in terms of the precautions that our students and our employees need to take is really something they should be doing lifelong, right? So I would ask the superintendent also if he would work with Claudia Shea. You know, there's a lot of trendy music things that are out there right now, like rap stuff for the washing the hands, to teach if we do have something that we do to communicate on these different steps, different things, not just the ABCs, because the older kids are not going to really want to do the ABCs, but there's a lot of fun stuff. But this is something that's lifelong. It will cut down on the absences from other illnesses. It can cut down on flu. So I think we need to use it that way, but I want to thank you. This was very informative.
I want to say that nothing teaches the kids better than the kids, so maybe you could get the kids to come up with those little rap songs. They're much better than we are.
Dr. Alonso, I have a question for you. In a few months, couple will be planning on marching 12,000 students across the stage and shaking their hands, putting 5,000 people 3 times a day in the fairgrounds buildings. What is your take on that?
Well, I came in and hugged everybody, so I'm okay. Like I said, we can still shake people's hands. We have sanitizers after, so as long as you shake somebody's hand and you don't stick it in your mouth right after you shake their hand, you're okay. I think we're going to have to, it's the same thing as the trips. We're going to have to go day by day and see how things change. Right. If Florida stays the way it is now, we have no problem. It's not likely. It's inevitable that we will have more disease. But we didn't cancel any graduations that I know of in H1N1. So let's hope for the best.
I think my response to that is we're not going to cancel the graduations unless you tell us to.
Yeah. No, I'm not going to tell you to do.
But we may look at augmenting our procedures in terms of shaking hands, not just for the student safety, but just for all of the staff. I mean, everyone pretty much in this room will be in those graduations, and I can't afford for all of us to be on quarantine at one time.
Mrs. Andrews.
Thank you. This question came up last night from a parent. Sometimes students can bully and be cruel if they have perceived notions of things. I would hope that this school district would have something in play at each school to help educate our students, certainly about this, but also about how we treat each other and respect each other. And if they have misconceived information that they've actually acquired through other places and not at the school, that our school leaders will work with the teachers to help them go through some kind of training so that our children won't be bullied or have some real bad issues because of something that's happened. And as it gets a little bit more, as it's fluid, I think you're going to have some outrage from students. And so I don't know if we have a plan of action. So that goes back to the superintendent and the team. Do we have something in place to help the teachers so that we can educate the students better so that they can, know what the issues are as we go through this?
There is a section on the CDC on cultural sensitivity. People are very cruel, and you're going to have plenty of samples if you haven't had them already. People are excluding anybody who looks like they're from anywhere in Asia. And most of the people that we see that look like they're from Asia have never been out of the United States. So it's a reality. We have to know that it exists, and we have to stop when we see it happening.
All right, I think we're done with our questions for now, if you want to continue.
For the record, Paul Strauss, Director, Environmental and Conservation Services.
Okay. You got to switch. You want me to switch the thing
Yes.
for you?
Thank you, Dr. Alonso. I'd like to emphasize two things before we get started. First is the strength of our relationship between the school district and the health department. We work very closely together. We collaborate on a number of issues, including infectious disease, which we've done for many years very successfully. Also, that student health, student, staff, employee, teacher health, safety are top priorities for the district, and our response efforts are being coordinated at the highest level of the district and involves all the different departments. What you're seeing here is really just the tip of the iceberg. We've got a lot of people moving in the same direction to make sure that we have a comprehensive response to this issue. So there are a couple of board policies that cover the district's infectious disease response programs, and you see them on the screen now. Two of them are medically related. They're really about student and child care and reporting with some health department tie-ins as well. And then, of course, we've got IAQ policy 7.195 that sits in my wheelhouse that provides standards for sanitizing, for custodial standards, for air conditioning systems that help us deal with infectious disease outbreaks. In 2015, Environmental and Conservation Services created the district's infectious disease plan. We did it with the help of a lot of support departments within the district and also help from the outside, and industrial hygienists helped us with a lot of the standards. It also includes a supplemental cleaning guide, guidance document that helps us with, once again, sanitizing standards for a whole range of different infectious agents that we might come in contact with here at the school district. In order to implement that plan, we created an infectious disease committee. And you see the members there, 8 plus our department chairs that meeting every year. We've just expanded it to include some more folks, but everybody actively participates, from school police and school food services and maintenance with their custodial personnel, and then, of course, our internal school health specialists. Right, so, once again, we work very closely internally with our professionals to make sure that we have a coordinated response to infectious disease outbreaks. And the support services department and their health professionals there are a really great asset to the district and help us to guide our actions if we have an outbreak. I can't overemphasize the importance of our school nurses and our school nurse program. They are our eyes and ears at school centers. They are really keeping the pulse of illness at those centers, the trends that are occurring. They know the students by name. They're either treating them on a daily basis, and they relay that information back to us so that we can act on it in real time. I can literally get a call from a school nurse, and then I can bring service to that school almost immediately. They also have a protocol that they follow through the health department for reporting certain infectious agents, and then that triggers a whole new response action that involves coordination between the health department and the school district. We also have, through those policies, procedures, and committees, some internal processes that include the enhanced sanitizing that we implemented a few days ago. Just a little bit about the department and the resources we have available to help. So our department is a 13-member team of environmental professionals that are highly certified both in environmental project management and in infectious disease outbreak response. We've been doing this work for a long time, a number of years, and our folks have a lot of experience on the ground, boots on the ground doing it with a range of different infectious agents. We also have a a full array of contractors and consultants that we can rely on to bring in if we need to. That's scalable. They are, the contracts that we have for those folks include subcontracting, so if I need to bring in resources from out of the region or out of the state, we can do that. We can meet whatever challenge we need to through those contracting pieces. And then I just wanted to give you a brief overview of the few things that we're working on. There's a lot of initiatives that we're all working on, and that will continue to increase as conditions change. And one of the first important pieces that we rolled out was revising and update our continuity of operations plan to make sure that if there was some significant impact from the virus, that we would be in place to ensure leadership keeps going and the district keeps running at the high standard that this community expects. Then as part of that plan, there is a supplement specifically for flu pandemics. That is also being updated as well. I have had numerous conversations with Chief Kitzero about coordination of our efforts with the county and attending meetings or making sure that we're all on the same page with whatever response actions we work with the health department on. And of course, I mentioned the health department, but also CDC and Florida Department of Education as well. All of the updates that they're providing, we're staying on top of minute to minute. The Office of Communications and the rollout with the district web content is helping us spread the word across the district. And then finally, we are preparing a principal's guide that'll be rolled out soon so we can get some information into the hands of the people who are leading our schools. And if there's any questions, I'd be glad to help.
Questions? I see none.
See, you did a better job, because you didn't get any questions.
Thank you, Paul.
Thank you.
Thank you all for, Dr. Alonso, again, thank you so much for coming and sharing your wisdom with us, and we look forward to continued partnership over the next few months. Thank you, Ms. Paul. Thank you. And Mr. Strauss. At this time, I will have the Deputy Superintendent, Keith Oswald, come forward with his team